Hello, and welcome to Celiac.com news. Subscribe to our channel to get the latest celiac disease and gluten-free diet news. And if you have any questions, be sure to join the Celiac.com forum online at Celiac.com. And now, let's move on to the latest Celiac.com news. Digestive system cancer risk in autoimmune disease. What it means for celiac patients. Digestive system cancers are among the most common and deadly cancers worldwide. Often diagnosed late because early symptoms are unclear. Researchers are paying close attention to groups who may face higher risks in hopes of improving prevention and early detection. One area of focus is the link between autoimmune diseases and cancer. Conditions such as celiac disease, type 1 diabetes, systemic lupus erythematosus, and multiple sclerosis involve chronic immune activity and long-term inflammation. This constant stress on the body, along with lifelong treatments, could contribute to tumor development. A recent systematic review and meta-analysis examined dozens of studies to clarify this connection while accounting for past research bias. The study's goal was to evaluate whether these autoimmune diseases increase or decrease the risk of digestive system cancers, including those of the stomach, esophagus, pancreas, small intestine, liver, gallbladder, colon, and rectum. By analyzing more than 1.5 million cases across 47 studies, the researchers provided more reliable estimates than individual studies, many of which were limited by smaller samples or inconsistent definitions. The findings revealed a mixed picture. Celiac disease was linked to higher risks of pancreatic, esophageal, colon, liver, and especially small intestine cancer, with small intestine cancer risk more than 4 times higher than average. Lupus patients showed increased risks of pancreatic, liver, colon, and esophageal cancers, but not stomach or rectal cancers. Type 1 diabetes was connected to greater risks in several areas, including stomach, pancreatic, liver, colon, esophageal, and gallbladder cancers. Multiple sclerosis stood apart, showing an inverse relationship, with lower risks for pancreatic, esophageal, rectal, and colorectal cancers, though the reasons remain unclear. Why might autoimmune diseases influence cancer risk? Chronic inflammation can damage tissues and encourage abnormal cell growth, while immune-suppressing treatments may reduce the body's ability to detect cancer. On the other hand, certain immune patterns in multiple sclerosis may actually improve cancer surveillance, offering possible protection. For people with celiac disease, these results are especially important. The elevated risk of small intestine cancer has been known, but this study also confirmed links to pancreatic and liver cancers. Even those on a strict gluten-free diet may require careful, long-term monitoring. Encouragingly, no increased risk was found for stomach or colorectal cancer, providing some reassurance. Still, the broader risks highlight the importance of awareness for both patients and doctors. Living with an autoimmune disease is already complex, and the potential for higher cancer risk adds another layer. Regular medical checkups, open communication with healthcare providers, and prompt attention to symptoms become even more critical. From a healthcare perspective, the study suggests that screening and prevention strategies should be tailored for autoimmune patients to catch cancers earlier and improve outcomes. In conclusion, this large-scale review clarifies the relationship between autoimmune diseases and digestive system cancers. It confirms elevated risks in celiac disease, lupus, and type 1 diabetes, while multiple sclerosis appears to offer some protective effect. For celiac patients, these findings reinforce the need for vigilance beyond diet alone. Managing an autoimmune disease means not only controlling symptoms, but also protecting long-term health through prevention, awareness, and ongoing care. To get the latest celiac disease news and information, be sure to subscribe to Celiac.com news. Thank you for tuning in, and see you next time.